Maternal sepsis, postnatal education for women and their families. Natalie Sanchez, 320-42134. What is maternal sepsis? Sepsis is a life-threatening condition that occurs when the body has an infection, and the body response to the infection damages its own tissues and organs. If not recognized and managed early, it can lead to a septic shock, multiple organ failure, and death. Maternal sepsis most commonly occurs during the postpartum period. A high number of women develop sepsis after hospital discharge. Worldwide, sepsis is one of the leading causes of maternal death. How you can get sepsis? Sepsis can occur in response to different types of infection, including bacterial, viral, or fungal infections, which can be occurred in the healthcare settings or in the community. If you can see in the photo, the bacteria enter to the body and create infection. The body fights infection with early inflammatory responses through the body, which can damage its own tissues and vital organs. If you can see in the photo, its own tissues, it can damage and leaky vessels. So this can create low perfusion to the organs and damage the vital organs. There are common factors of infection during postnatal period. That includes intravenous cannula, bacteria can go in through the open wound, urinary tract infection, wound and perineal infection, that's also an open wound that can enter the bacteria, endometritis, instrumental birth, retained placenta tissue, and mastitis, that is breast infection. The breast infection is also can occur with the milk that it can be obstructed, or with the enlargement of the breast and the nipple cracks, that also is an open wound, then you can get bacteria and get infection. You can prevent maternal sepsis with early treatments, so it is essential to recognize signs and symptoms and observe and notify to your midwife. It is essential for you and your family to recognize signs and symptoms of sepsis to reduce sepsis and septic shock. Please observe these signs and symptoms such as high or low body temperature, high or low heart rate, low urine output, impaired mental status, that it can be dizziness or feeling confused, nausea, vomiting, diarrhea, or feeling very unwell, shivering, difficulty of breathing, low blood pressure, change in skin color including rash, or extreme body pain. Maternal sepsis can be managed. Adequate management of maternal infection and sepsis can reduce morbidity and mortality. It is vital to have an effective prevention and early identification. Effective sepsis management include rapid escalation and review with the senior clinician, that is the doctor. Will be closely continuing monitoring your vital signs, and sometimes depends on the severity, you will be continue to treatment with an ICU, that is intensive care unit, is 24 hours, one-on-one, to ensure that your vital signs are okay. Urine tests and blood tests that include the blood culture, full blood count, and lactate to determine what is the bacteria, what is causing that infection, and give you the correct treatment. It is vital to initiate sepsis management as soon as possible, and this included treatment. The goal of sepsis treatment is to achieve body stabilization, stop the progression from sepsis to septic shock, and improving that tissue perfusion to limit cell dysfunction, that is damage to your vital organs. The treatment includes always checking your allergies to ensure if you have allergies, ensure you notify to your midwife or doctor. We will administer oxygen to help the body stabilize. We will give you the antibiotics after the blood test to ensure that the blood test is not affected by the antibiotics, and we will modify if it's needed. Also, we will give you some hydration with intravenous fluids. Once you got your sepsis treatment and you feel better and you're ready for discharge, it's essential to recognize signs and symptoms of infection. The postpartum period is defined as 6 weeks after birth, and infections are more common during this time. So it's recommended to have good hand hygiene and good wound care and identify any signs and symptoms of infection to get early treatment and prevent negative health outcomes. It is essential to notify to your doctor if you have signs and symptoms of sepsis, and depends on the severity. Please attend to your hospital or to your local hospital or call 000. Maternal sepsis can be a traumatic event. Evidence shows that women who experience a traumatic event during the postnatal period can develop post-traumatic stress disorder. Post-traumatic disorder can negatively impact your maternal mental health, developing postnatal depression, affecting mother and infant boarding and breastfeeding, and impairing the relationship with your partners and families. So it is essential to look for your mental health. If you're not feeling mentally well, with no good mood, and you think it's affecting your maternal period with your baby and communication with your partner, if you're not feeling well, please refer to your doctor. For future pregnancies, please notify to your midwife or doctor that you had previous sepsis. You can develop sepsis during pregnancy and the interpartum period. If you had previous sepsis, you are at high risk of developing sepsis again. Recognizing signs and symptoms of infection and sepsis during pregnancy is essential. There are risk factors of maternal sepsis in pregnancy. So please look for things like obesity, diabetes, impairing immunity, or immunosuppressant medication. If you have anemia, any vaginal discharge, history of pelvic infection, history of group B streptococcal infection, or if you had any amniocentesis or other invasive procedures, cervical cerclage, or prolonged spontaneous rupture of the membranes. These are risk factors that you have to look when you get pregnant again to prevent and look close monitor to those signs and symptoms to prevent sepsis. If you notice signs and symptoms of sepsis, please visit to your local hospital or call 000. If you had sepsis or sepsis treatment and you're not feeling well and need support, please refer to health services that it can help with your doctor. Contact your doctor for follow-up and further medical treatment. And please feel like you're not alone. You have support, and there are another services that can help you with mental health support is Beyond Blue. The contact number is 1-300-224-636. And another support health services is Pregnancy Problem House, that you can contact them for service to the number of 1-300-200-406. Please not feel alone and contact any health services and support for further treatment.